Big Five. So let's start with arterial disease. So arterial disease begins with injury to the endothelium. The endothelium is the inner lining of the blood vessels. When they are healthy, the endothelium produces nitric oxide, which keeps vessels flexible and regulates inflammation. When they're injured, nitric oxide will drop, oxidative stress will rise, LDL becomes oxidized, and plaques will begin to form. Chronic periodontal and endodontic infections contribute to this injury through systemic cytokines like interleukin-6 and TNF. So let's talk about heart disease. So heart disease is the clinical outcome of arterial instability. It is fundamentally inflammatory. Components of periodontal pathogens have been identified in arteriosclerotic plaques, and some of the key microorganisms include Porphyromonas gingivalis, Treponema denticula, Aggregatibacter, Actinomyces tenscomin. These bacteria don't cause heart attacks, but they do activate immune pathways that can contribute to plaque instability and endothelial dysfunction. So dentistry per se does not treat heart disease, but it can reduce one of the inflammatory inputs that can drive it. So let's talk now about diabetes. Diabetes and periodontal disease have a bidirectional relationship. Chronic oral inflammation can elevate cytokines, can increase insulin resistance, and can worsen glycemic control. Clinical studies have shown that periodontal therapy can improve HbA1c levels. In metabolically vulnerable patients, uncontrolled biofilm can become another weight on the system. So it's really important to treat gum disease if a patient has diabetes. Now let's move to Alzheimer's disease. A lot is being said about Alzheimer's, and the brain is extremely sensitive to inflammation. So chronic systemic inflammation can activate the microglia, can disrupt the blood-brain barrier, can promote neurodegenerative processes, and there are certain periodontal pathogens, particularly Porphyromonas gingivalis, which have been implicated in Alzheimer's-related inflammatory pathways. So cancer is at number 5. So cancer thrives in inflammatory environments. We all know that. There is one oral pathogen that deserves attention here. It's only found in the mouth, and it is called the Fusobacterium nucleatum. This microorganism is associated with periodontal disease and also oral dysbiosis. When it's swallowed, it can survive transit under certain conditions. There can be a biological environment that might support tumor growth or progression if the cancer is already developing. So again, it's a risk factor, and it works as associations.